Hello, and a warm welcome to Your Health Matters with me, Susan Mwongeli. Now, a lot of women are choosing to delay having babies until much later. Yet, the common understanding is that when you hit 30, things become a bit complicated, but women are still choosing to wait. Even the other day, we saw Naomi Campbell announcing that she'd become a mother at the age of 50, so it is possible. So if you're among those who are choosing to wait, what should you expect when trying to have a child after 35 years? Here with Dr. Maureen Owiti, who is an obstetrician, gynecologist, and fertility is one of the subjects that she likes to talk about. And there are many questions. And again, fertility is quite wide. So we'd just like to focus, for this episode, focus on fertility after 35 years. Yes, can you tell us what happens to a woman once she hits 30, let's not even say 35, 30, because there's all this, zama tema, unajua kabla ufikishe 30.
It's not a myth. That is what women have to understand. And we have many women, they come, they're 40, they're like it's their first marriage, they've done their thing, and now they're ready to have a baby. Mm-hmm. And you tell them, chick, story yako, sipa. In fact, can you do a donor? And she looks at me like, Daktari, what's wrong with you? I can people in my family have children or 50s.
Yeah.
And I'm like, okay. So the issue with women, let me not say issue, it's our physiology. And I would strongly agree with those people who tell you, Zama Pema. Zama Pema from point of view. Women, unlike men, are born with all their eggs. So if I'm to take you through an embryology class, your eggs are formed when you're still in your mother's womb. You have your maximum amount of eggs at about 6 months still inside your mother's womb. You have about 7 million eggs at that point in time. By the time you're born, they're down to about 1-2 million at birth. Okay? By the time you hit puberty, we're down to 400,000, 500,000. What we're telling you is as we grow, our eggs are getting depleted. So statistically, and this is research from populations, okay, we know that women up to the age of 35 would have similar levels of capacity to have children, and that is when you're at your peak. Okay? And this is statistically, there are some people who that peak is lower, you understand, in that their fertility starts dropping earlier. There are some people that window is a bit extended, but we call those outliers. Okay? Any population is going to have outliers. So we're talking about women who want to conceive. So up to 35, we're good. And we'll recommend all women to try conceive, at least have your first baby before 35. After 35, so our eggs, so it's not to say that these eggs stopped declining, but now the decline becomes even more rapid, so it goes, okay? So it's why you find at 40, we have not said you cannot conceive at 40. What we're just saying, it's not an easier thing to do. Again, numbers. The probability of conception in a month, okay, it's about, say, 24%. Okay? Now you find for somebody 40s, will be down to those 2%. Okay? And those are all factors stable. Sperm count is fine, everything is okay, no tubes, no nothing. Okay? Again, you've not conceived all the way up to 40. The uterus was made for carrying babies. Unfortunately, as Africans, we're very high risk for a very common disease called fibroids. So you find, you're in your 40s, no children, massive fibroids, again impact, in as much as fibroids will not necessarily stop you from conceiving, but will have an impact on either the pregnancy, implantation, and things like that. Okay?
Yeah. Now let's talk about, so is it a myth or is it a fact that, again, at that age, getting pregnant at that age, the baby has more chances of having deformities?
Okay. So, again, just like to put it more in context, that would be correct from point of view because of the age of the embryos. They are now more prone to abnormalities. So the eggs, so those embryos have what we call a nucleoides. A nucleoides, just to try to break it down, would be like you talked about DNA. So we have our genetic component. So for humans, we have 46 chromosomes. These are the general chromosomes. And then we have 2 sex chromosomes. So you're a woman, so you look normal. So my assumption is your genetic component should be 46 XX. The cameramen, for some strange reason, they're all men. I don't know why. But they're here with us. For those who don't know, let's acknowledge them. They're doing a fantastic job. Okay? Their component would be 46XY. Y being what is giving them their male characteristics. Okay? So, a nucleoides would be something like somebody has 46XXY, so it means the numbers are abnormal. Somebody can have a double component like 96XXXYY or X like that. So a nucleoides is abnormal number of chromosomes. Okay, so you find in these older women, they are more prone to have eggs that would have babies that have abnormal number of chromosomes. The beauty about it, majority of them are incompatible with life. So that's why they tend to have a lot of early miscarriages. Those that do progress would be the normal ones. So it's not to say that they can't have normal babies, okay? And even I had a patient who had Downs. We had confirmed she lost that particular baby, but we confirmed had Downs, and she was able to afford a consultation with a geneticist. So she had a genetic consultation. And even for her, she was over 35. Positive history. So the moment you've had a baby who has confirmed congenital abnormality, your risks go really, really up. And even for her, the geneticist told her she still has a 78% chance of having a normal pregnancy. So it's not to say that because you're older, yes, your chances of having babies abnormalities are higher, but it's not to say that all your babies are going to be 78% of the time. If you are pregnant and carry to term, they will be normal. So also that type of reassurance.
Yeah.
Having had said that, why do we want to wait to be 40? Now there are all these things, fantastic things women tell me.
I want to get my life together.
I want to be a professor. Yes. I want to drive, I don't know.
Yes.
HSC, I'm a Porsche Cayenne,
yes.
Which is all good. And I tell you, with the amount of technology available right now, I think, I don't know if you watch Keeping Up with Kardashians, their mother looks almost like them.
I know.
I don't know what she's doing. So at 60, you can look like a 20-year-old if you want. Okay? At 60, you're not gonna get a baby like a 20-year-old, no matter what you do. So it's women really aligning their priorities with their biology. You want to be a professor.
Aligning your priorities with your biology.
Yes. You want to be a professor. Right now, very good. If I want to be a professor, I can be. If I want to be a lawyer, I can change and be a lawyer. So those are things you can do anytime. What people forget, all these other things can be done at any time, at any point in your life.
But
getting a baby is not something that can be done at any time. However, unless you're those really bougie people, you want to store your eggs, but how many 20-year-olds are going to be able to afford storing their eggs?
And what you say, I mean, resonates, especially, with the younger ones, they have time. But assuming you're speaking to somebody who's now gotten, what they were looking for, and now what they want is to have a baby, what options are there, or how can they increase their chances of conceiving at this age?
It's so interesting because I think the last topic we have what we call continuous medical education, and that was one of the topics we were doing of the older women. What are their issues? And it's really just fact and really just understanding that some countries will not offer fertility treatment if the woman wants to use her own eggs. It varies in different countries. Some countries will say 38, some countries will say 40. They will not touch you. You look at the Western world because they have a different problem.
What do you mean? Just come again.
So you come, we're talking about a woman who's over 35.
Yes.
Okay. You have a fertility problem. You want to have children. So we say maybe your tubes are blocked. Your husband has very low sperm count. Your option is IVF. Okay. IVF in the Western world.
IVF,
in vitro fertilization. So that's when we create babies outside. Okay? In vitro fertilization is one of the treatment options for people who are not able to get children. It started initially for those who have blocked tubes, but we have advanced till we're able to do what is called ICSI. So that is when we directly inject the sperm into the egg for male infertility. So before IVF, we're not able to sort some male infertility issues, but now with ICSI, we're able to do both. So in the Western world, the government actually pays for your IVF. And around the world, IVF ranges from anything to $500,000 to about $1 million shillings per cycle. Okay? So it's a very expensive treatment. But Western world, they have the problem, their population is going negative numbers, so they will pay for IVF. But you find because of the low success rates in older people, some countries limit who can get IVF. So some countries the figure is 38, others 40. You will not be allowed to do IVF if you're opting to use your own eggs. So what are the options? The options would be to use donor eggs. So donor eggs be for somebody slightly younger. Options could be to still try by yourself, because we're not saying 100% you can't conceive. Or opt to adopt, opt to go the surrogacy way. So those are all fertility options.
And then there's this, you hear a lot of people talking about harvesting their eggs.
Yes.
Can you tell us a bit more about that? And then again, it almost appears it's a Western concept. Is it happening locally?
Yes.
Are there those options? Yeah.
So fortunately, that's the field I'm in. We are able to harvest and store eggs of younger people. The challenge we have is you look at, if you can remember what status you are at, maybe at 28, when would be the ideal time to harvest your eggs. Were you in a position to think of spending $500,000 on storing your eggs? So that's just the sad reality. So it is possible, it is available, but maybe it's not feasible if you look at it from that perspective.
What's the cost of doing that?
About $500,000. Yes.
Are there plans to make this affordable to?
It's we feel over time as more and more IVF centers come up, as we use more the technologies that are available, because cost of any item is always the supply and the demand. The demand is high for the services, but those who are able to provide the services are still not that big a number, and so because of that, the cost is still relatively quite high.
Maybe just to explain, so we harvest the egg, we store it, and then we use it when we are ready.
Yes.
And once it's implanted, it works.
It works very well.
Oh, okay.
Yeah, because you'd have a better chance with younger eggs than you would with older eggs. And remember we talked about the aneuploidies, that's the abnormal numbers. In a young person, they have less of that. So that is why they get pregnant more easily.
Back to trying to increase your chances after 35, the role of fertility drugs.
Okay, as we said, for me, it's we discuss with the patient and look at what their treatment options are. Remembering, no two patients are exactly the same. So I always have that, oh, my friend did this and it worked for her. We thank God that it worked for her, but no two patients are exactly the same. So that's something with your doctor, you'd have a look, they'll tell you what your status is and what your options are.
I mean, a couple of weeks ago, there was all this talk now, Campbell had had become a mother at 50. Chances, surrogacy. Maybe we can talk about that. And that being another option of a lady who's trying to look to get pregnant after 35.
Okay, so again, I'm not privy to how Campbell conceived.
Yes, she's a new mom.
I said I'm not privy, but as I've said, there are people called outliers. I happen to know quite a number who, in their 50s, have had natural conception, but they are not the norm. So don't look at your friend, 50 years, got a baby, they're normal, and that's going to happen to you. The sad reality, that is not the reality for majority of women. Let us just take a sit back, and I said, please align your life with your biology. Okay? If you do that, everything is well. You can afford at 28 to store your eggs and you want to do all those things, by all means, because I think you've seen, I think the oldest mother is, almost 70 in India. They, 100%, I can tell you without thinking, use donor eggs, because at 60, 70, you're menopausal, these eggs were coming from where? Okay? So, donor eggs, we can get anyone, no matter how old they are, as long as the uterus is not having abnormalities, we can get them pregnant. Okay, but I cannot use your own eggs at 50, 60, 70 and get you pregnant.
Wow. Then there's also the option of adopting, isn't it?
Yes, so those are all the things, and if people, it's just that the problem women have, the doctor tells you this, you move on to the next doctor, and you want to be told what you want to hear. And unfortunately, they go to till herbalists, they go to all sorts of things, desperate, because it's like you're in denial. This is very difficult information to relay to somebody that I'm telling you because you're 40-year-old. We've checked, there's a hormone we check that tells us what your egg reserve is, and your egg reserve is negligible. Your best option is adoption. You can imagine what that woman is going through when they're being given such information. So for me, it would be to educate the young women who are out there that please do things at the right time. That shosho and auntie telling you Zama Pema is actually doing you a favor. Okay?
Do men go through the same? The sperm count and stuff?
As I said, unfortunately for women, ours is very specific. I always give the example to my patients. Forgive me, Jega Karume, rest in soul, but he died over 80, okay, and left a 3-year-old.
Wow. Wow.
But it's not to say that men also do not go through obviously sperm count will not be as good and stuff, they still have, but the effects of age on men is not as severe as the effect of age on women regarding fertility. Everything else right now, you can be talking to you see the 20-year-old lady, Kienda kuona lizaliwa sijui 1900.
I know we're talking about fertility and trying to get pregnant, and pregnancy is a whole different topic, but I'd like you maybe to just tell us how pregnancy looks like for a 35-year-old or anyone above 35 years.
Okay, so again, above 35, and especially I would go more above 40. All said and done, the problem is anyone above 40 is more prone to complications. So you find it's the age we're getting hypertension. It's the age we're getting diabetes. It's the age we're getting all of those things. So we have in obstetrics extremes of age. So you find the very young, so our teenage moms again are more predisposed. There's the specific high blood pressure in pregnancy, what we call preeclampsia. Okay, so it always comes in extremes of age. It's the very young, or the older moms. Okay, diabetes, it's the very young, the older moms, and all these other complications, miscarriages because of incompetent cervix. So you find they're more prone to complications. So obviously, your ideal. I always make fun in a consultation. I also did not deliver at that particular age, but if somebody was to stress me and give me one number, one age I find ideal for women to give birth, what number would it be? I always say my number is 28. I did not have my own kids at 28. Okay, it was a bit later, but it's an age whereby at least you're somehow settled, you've been through campus, maybe you have your first job, so you're not too young, not too old. Please, it's not a prescription for everybody, it's just a guideline. Again, there are all these things because also you're talking with somebody, you want to have a baby.
Wow. All right. Well, I think for me, I would want to take home that it might be difficult to conceive after 35, 40, but it's possible.
Yes, it is possible. And let's look at our options. Let's be realistic. And let's go for it. We can have a baby.
All right. Thank you very much. Always a pleasure having you with us. And yeah, if you have any other questions, I'm sure, again, fertility is so wide. If you have questions, please send them in. We will ask Dr. Maureen, and I'm sure you'll be willing to answer these questions. Again, please subscribe to this channel and share this video far and wide so that we're able to reach more people. Until next time, do have a good time. I wanted to say evening, but have a good time. See you next time.